What causes dementia in senior aged humans? What exactly is dementia? Dementia is an umbrella term for a collection of symptoms caused by brain abnormalities. Symptoms may include memory loss and issues with thinking, problem solving, or speaking, which can be severe enough to impair a person's ability to complete daily tasks. Dementia patients may also report changes in mood or behavior. Dementia is a progressive disease, which means that symptoms will worsen over time as more brain cells are injured and eventually die. As a result, it is critical to schedule a comprehensive medical examination as soon as feasible. What factors contribute to dementia? Alzheimer's and associated dementias can have a variety of origins depending on the types of brain alterations that occur. While research has discovered that certain abnormalities in the brain are associated to particular types of dementia, the fundamental causes are unknown in the majority of instances. Rare genetic alterations have been linked to dementia in a tiny number of persons. Although there is no proven prevention, leading a healthy lifestyle may help minimize risk factors related with these diseases in general. What are the dementia risk factors? Age and family history are risk factors for getting dementia. Age and a family history of dementia are risk factors that cannot be changed. Abnormal genes linked to Alzheimer's disease have been found. However, they are only rarely involved in the illness's progression. High blood pressure, high cholesterol, and diabetes all raise the chance of developing Alzheimer's disease or multi infarct dementia. Some drugs can cause memory issues that resemble dementia. Dementia types. Alzheimer's disease is number one. Second comes vascular dementia. Third, dementia of the Lewy body. Fourth, frontotemporal dementia. And fifth, dementia caused by alcohol. Down syndrome and Alzheimer's disease are two of the most common causes of death in the United States. Sixth, HIV-related dementia. Dementia caused by chronic traumatic encephalopathy, CTE. Huntington's disease, Creutzfeldt-Jakob disease, CJD. Argyrophilic grain disease, mixed dementia. What exactly is mixed dementia? People with dementia frequently have more than one type of dementia. Many persons with dementia, for example, have both Alzheimer's disease and vascular dementia. Researchers who conducted autopsy studies on dementia patients' brains concluded that the majority of people aged 80 and older likely have mixed dementia caused by a combination of brain changes related to Alzheimer's disease, vascular disease related processes, or another condition involving the loss of nerve cell function or structure and nerve cell death called neurodegeneration. Scientists are looking into how the underlying disease processes in mixed dementia begin and interact with one another. More research in this area will enable researchers to better understand these disorders and develop more targeted preventive and treatment techniques. Doctors first determine whether a person has an underlying potentially treatable disease that may be related to cognitive impairments before diagnosing dementia. A physical exam to assess blood pressure and other vital signs, as well as laboratory tests of blood and other fluids to examine levels of various chemicals, hormones, and vitamins, can assist identify or rule out potential causes of symptoms. A review of a person's medical and family history can reveal vital information concerning dementia risk. Typical questions include whether dementia runs in the family, how and when symptoms began, changes in the behavior and personality, and whether the person is taking any medications that may cause or worsen symptoms. The methods listed below may also be used to diagnose dementia. Cognitive and neurological evaluations. These exams are used to evaluate cognitive and physical functioning, memory, problem solving, language abilities, and math skills, as well as balance, sensory response, and reflexes, are all assessed. Scans of the brain. These tests can detect strokes, cancers, and other conditions that can lead to dementia. Scans can also detect changes in the structure and function of the brain. The following are the most common scans. CT is a type of imaging that employs X rays to create images of the brain and other organs. Magnetic resonance imaging, MRI, is a type of imaging that employs magnetic fields and radio waves to create detailed images of human structures such as tissues, organs, bones, and nerves. PET, or positron emission tomography, is a technique that employs radiation to produce images of brain activity. Psychiatric examination. This assessment will assist in determining whether depression or another mental health disorder is causing or contributing to a person's symptoms. Genetic examinations. Some dementias are caused by an individual's genes. In certain circumstances, a genetic test can determine whether or not a person is at risk for dementia. It is critical to consult with a genetic counselor before and after having your DNA tested, as well as with family members and your doctor. Blood tests are performed. Doctors can now request a blood test to evaluate levels of beta amyloid, a protein that accumulates abnormally in Alzheimer's patients. Several other blood tests are in the works. However, these diagnostic tests for Alzheimer's and associated dementias are still in short supply. Early diagnosis of symptoms is critical since some reasons are treatable. In many cases, however, the etiology of dementia is unknown and cannot be addressed. Obtaining an early diagnosis, however, might aid in treating the disease and preparing ahead. A person suffering from dementia may choose to donate their brain. Brain donation aids researchers in their studies of brain illnesses such as Alzheimer's disease and associated dementias, which afflict millions of individuals. Researchers learn more about how different varieties of dementia affect the brain and how we might better treat and prevent them by studying the brains of people who have died. There is no fee to the family for the donation, and an autopsy report when donating as part of a research study or to the NIH Neurobiobank. Other illnesses that generate dementia like symptoms can be treated and even reversed. Normal pressure hydrocephalus, a buildup of cerebrospinal fluid in the brain, for example, often disappears with treatment. Furthermore, physical illnesses such as stress, anxiety, depression, and delirium, as well as the side effects of certain medications, can induce substantial memory impairments that resemble dementia. Who is qualified to diagnose dementia? Seeing a primary care physician is frequently the initial step for those experiencing changes in their thinking, movement, or behavior. However, neurologists, specialists who specialize in brain and nervous system problems, are frequently consulted to diagnose dementia. Dementia can also be diagnosed by geriatric psychiatrists, neuropsychologists, and geriatricians. Your doctor can assist you in locating a specialist. Having someone visit who can help with odd jobs around the house might be a good method of retaining independence for persons with moderate signs of dementia. Your loved one with dementia may have always been a highly independent person who enjoyed being out and about, shopping, meeting friends, driving, or taking public transportation, and generally looking after oneself. However, as dementia symptoms appear, they may require more assistance. At first, this may not be for conventional care concerns like washing or dressing, but rather with more practical issues like shopping, gardening, getting to a weekly bridge, playing group, or simply having someone to chat to. This is where companion care can come in handy. Dementia related common behaviors. Abrasive behavior anxiety related behavior, fluctuations in emotions, forgetfulness, hallucinations, hoardings, misperceptions, irrational behavior, wandering, repeated behavior, wishing to travel somewhere, not wanting to do certain things, repetitive actions at dusk, not giving a hoot about other people's feelings, problems with mobility and loss of balance. When a progressive dementia is identified, the phases of dementia are applied. The stages are as follows. Stage 1. There is no impairment. There are no issues with the patient. Stage 2. Suspicious impairment. The patient begins to struggle, yet he or she can still function independently. Stage 3. Moderate impairment. The patient is clearly having difficulty with daily chores, but it is just modest. Stage 4. Moderate disability. The patient requires assistance in caring for himself or herself as well as carrying out daily chores. Stage 5. Moderate to severe disability. Severe impairment. Stage 6. Patients are unable to function independently. Stage 7. Extensive impairment. Body and mental processes begin to deteriorate. What functions does mental exercise have in the prevention of dementia? It is believed that keeping the brain busy helps to build reserves of healthy brain cells and connections between them. The role that brain exercise may have in lowering the risk of Alzheimer's disease and other kinds of dementia has thus been the topic of extensive research. Numerous studies have found that participating in more mentally challenging activities throughout life is related with improved cognitive function, slower cognitive decline, and a lower chance of getting dementia. Brain stimulating activity may help to establish a brain reserve that can compensate for the damage caused by Alzheimer's or other disorders. Because the brain may compensate and continue to operate normally, the beginning of dementia may be delayed. What brain exercises are beneficial to the brain? Mental exercise can and should be a pleasurable aspect of one's life. Almost any form of mental activity can be good, but it must involve new learning, be somewhat complicated, varied, and entertaining, and be done on a regular basis. Some activities that require brain activity and have also been linked to a lower risk of dementia as part of a mentally active lifestyle are reading, listening to the radio, visiting museums, enrolling in a course, learning a new language, playing musical instruments, artistic and other hobbies, participation in leisure activities such as sports, hobbies, dance, gardening, groups, cultural activities, and conversation. Many of these hobbies include both social connection and physical exertion. According to recent study, mixing mental, social, and physical components in leisure activities provides the best advantage in terms of lowering dementia risk. While brain exercise has not been demonstrated to prevent dementia, it has been shown to lessen the risk of dementia or postpone its onset, and the overall health benefits of these exercises are well recognized. Is there any benefit to mental exercise for those with dementia? Research has also looked into whether exercising the brain might improve people with dementia's thinking capacity or delay the rate of cognitive decline, as well as how exercising the brain can contribute to a better quality of life for people with dementia, their family, and caregivers. There is evidence that prolonged participation in mentally stimulating activities may prevent cognitive and functional deterioration in people with dementia. People with dementia should be encouraged to continue with their usual hobbies and occupations to the greatest extent possible. While changes may be required as dementia progresses, remaining socially and mentally engaged may be beneficial to the person's cognition, daily functioning, and mental well being. What are the best brain workouts for people with dementia? People in the early stages of dementia can choose from a variety of brain workouts, including the ones described above. People in the later stages of dementia may choose simpler exercises that are tailored to their specific interests and abilities. Simple mathematics, reading aloud from books, storytelling, including brief stories and role playing in longer stories, to help raise attention and engagement and evoke emotions and memories. Imagery activities to excite the senses, such as recalling a serene nature scene, dancing, playing musical instruments, music listening. It is critical for people with dementia to remain involved and active in the activities they enjoy. Rather than abandoning tough things, it may be possible to alter them or divide them into manageable chunks. Selecting tasks that are beyond the person's skills might lead to irritation and a sense of failure. There may also be an opportunity to attempt something new, such as a new hobby or artistic endeavor, which could be enjoyable and add to mental stimulation. Interaction with others, social participation, and communication may be just as vital for a person with dementia as any direct benefits from mental activity. Is it necessary to reduce stress? Everyone should make every effort to reduce stress as much as possible. Excessive stress can result in reduced memory capacity as well as adverse physical responses such as poor sleep. Avoiding doing more than they can handle or doing more than one item at a time can assist persons with dementia avoid stress. Physical and mental exercise are both excellent strategies to deal with stress and its consequences. Using the brain to complete difficult tasks may divert attention away from some of the sources of stress. Why is mental stimulation necessary? There is no doubt that human beings require intellectual stimulation throughout their lives if they are to accomplish and sustain a fulfilling and unimpaired life. A certain decline in mental capacities is unavoidable as we age, but purposeful pursuit of cognitive engagement has been shown to dramatically delay this cognitive degeneration. Continuous mental activity improves the quality of all aspects of life. Mental activity increases reasoning abilities, memory, and the ability to continue learning through having a number of beneficial impacts on the physical state of the brain. Mentally stimulating activities are also extremely beneficial to general senior wellness, particularly in preventing or slowing the progression of Alzheimer's and other kinds of dementia. The range of beneficial activities is broad enough to fit a wide range of individual interests and includes puzzle solving, dance, board games, reading, and musical instrument practice. These kinds of mental exercises will also help seniors' emotional health, especially when paired with physical and social activities.